Aging Brain Study. She is also the main principal investigator and leader of the A4 trial, which is the first prevention trial in Alzheimer's disease for risk related to age. So it is my pleasure to introduce to you Dr. Risa Sperling.
Well, thank you guys so much for being here. And I first want to start by taking a selfie of me with you, because people often say to me, oh, you're working so hard, I'm trying to find a prevention and a treatment for Alzheimer's disease. But I always tell them, it's actually you guys who are doing all the hard work and helping us. So bear with me for 1 second. All right, so I had a plant in the audience already who wanted to know about what we're learning about early detection and risk. So I'm going to show you a little bit about that in the next few minutes here. And I'm going to try to do that by showing you some Mother Nature analogies, because I think this is really helpful in thinking about what we as a society are facing in Alzheimer's disease, and unfortunately what people themselves and their families are facing in Alzheimer's disease. So this first one is the proverbial tip of the iceberg. And this is because one of the big things we've learned over the past 30 years, and in the past 5 years in particular in the Harvard Aging Brain Study, is that at the stage of Alzheimer's disease when people already have a lot of symptoms and memory loss and are needing help with things, is really just the tip of the iceberg of what Alzheimer's disease is. And because we're doing a really good job of keeping people alive longer from heart disease and cancer, we're creating an epidemic of Alzheimer's disease. About 10,000 people, baby boomers, enter the age of risk for Alzheimer's disease at age 65 every day in our country. And we also know that the process, as Brad Hyman just told you, begins years before we can detect it. So underneath the surface here is really what we're facing as a society in Alzheimer's disease, with individuals who are getting older, entering the age of risk, and as I'll show you, some of them are already developing the changes in their brain that we think put them at increased risk for developing the symptoms of Alzheimer's disease. So if you took that iceberg and you turned it on its side, it would look something like this. And again, for the past 50 years, we've been really diagnosing and treating Alzheimer's disease at this stage, at the stage of dementia. About 20 years ago, colleagues at the Mayo Clinic and other folks realized that there was probably an earlier stage that you could detect Alzheimer's disease, which was called mild cognitive impairment. And people here have a little bit of memory trouble, but aren't really having trouble in daily life yet. And this was already a tremendous advance because we could find people having a little bit of trouble and hopefully bring them into clinical trials to slow the progression. But what we've realized in the past 5 years, again, a lot of hard work coming from you in the Harvard Aging Brain Study by being in these imaging studies, is that the process of Alzheimer's disease begins 10, 15, maybe 20 years before this stage, and we now call that stage preclinical. And one of the things we know is that in this very early stage, there are changes in the brain, which I'll show you, that look like Alzheimer's disease. But importantly, not everybody progresses down to develop symptoms. And as Brad said, and Teresa Gomez-Isla will show you, we're really trying to understand what is it that protects some people from these Alzheimer's changes. And unfortunately, what are the risk factors that suggest that someone's going to progress down towards developing symptoms? And importantly, which I'll talk a little bit about at the end, how do we keep people on this curve so that even if they've got very early changes, they don't progress to the symptoms of Alzheimer's disease that are so devastating to people and their families. So this is, I know it's early, I won't show you too many cut up brains, but this is what, when someone is kind enough to donate their brain to us after death, what we see under the microscope. And these are the plaques of Alzheimer's disease made up of this sticky protein called amyloid. And these are the tangles, the three-letter acronym that you were asking about before, a clump of a different protein, tau, that comes into the nerve cells. And until about 10 years ago, we really could only see these under the microscope. And one of the huge advances in the field is that we can now see this in the living brain through imaging. And that's what I'm going to show you next. So these are some pictures from the Harvard Aging Brain Study. Now don't go looking here for wondering which dot you are, because you don't know and I don't know. And one of the things I always get asked is, why don't you tell us which dot we are? And the only way we can really do these studies properly is this blinding, so that we don't know and don't bias our opinion of how people are doing on the basis of these results. But as we started these studies, this is what's called PET amyloid imaging. And we can now see those amyloid plaques in life using PET scans. And we know that the majority of patients who have Alzheimer's disease dementia, unfortunately, already have a brain full of amyloid at that point. Most of the people who we call clinically normal, people who are doing well, don't have amyloid. We think that's a good thing. But about a third of individuals already have evidence of amyloid plaque building up in their brains. Now that sounds really scary, and I guess it is, but the good news is maybe that's a point where we could intervene before they get symptoms. And if any of you guess how long it takes for cholesterol to build up in the heart arteries before you get a heart attack or a stroke? Any guesses? Well, exactly. So 30, 40 years. So in fact, Alzheimer's, these amyloid plaques are relatively youngsters. But it is the case, again, that this begins many, many years before we get to symptoms. And I'm going to call that a glass half full, because maybe we can do something about it. Now, what we have seen already in early detection is that we can follow people who have evidence of this amyloid plaque buildup versus those who don't at a given age, and ask what's different about them. And Dr. Renz-Doreen will be talking more about this in a little while. But one of the first things we started to notice is that even though all of the people in our Harvard Aging Brain Study are normal, they perform well, that those who have amyloid plaque buildup don't perform quite as well as those who don't have any amyloid plaque buildup, and particularly on some of these really hard tests, like all of those of you who've done those face name tests. How hard is that? So yes, I have to wear my own name tag in the mirror so I remember my own name most days, much less everyone else's. And we started to notice that this might be a sensitive test that tells us the brain is still okay, but it's having trouble with really hard memory tests. The next thing we notice, and this is the work of Rebecca Amarillo, is that some of you come in and say, I'm worried that I'm not performing as well around, that I can't, program the VCR. Well, we don't have VCRs anymore. DVDs, or can't take a selfie like I can't with my cell phone. Is this a memory problem? And many of the concerns we have are probably normal aging. But we've already found evidence that some of these concerns are suggestive that individuals might be building up amyloid in their brain. And we're starting to think that these people who have a lot of memory concerns, really noticing changes from year to year, and their study partners noticing, even when they're still pretty normal, that this may be a sign that these individuals should come in to trials and studies so that we can hopefully prevent them from progressing further. And then finally, we have now started to have some what we call longitudinal data, so follow-up over time. And we already do see that these individuals who have a lot of amyloid buildup, and particularly if they also have other markers like shrinkage of the brain and the important parts of the brain for memory, that they are more likely to demonstrate problems in their memory over 3 to 4 years. And again, our job is to try to intervene so that we can stop people from moving down this curve and hopefully keep them on one of these curves where they're actually getting better over time by practicing all of our tests. So here's my second Mother Nature analogy, which is a forest fire. And as Brad mentioned to you, one of the really exciting things that's going on right now in the science is the ability to not just look at amyloid plaques, but to look at these tangles, the tau, that we can now see for the very first time using these PET scans. And many of you have already participated in these early scans, and we're going to be begging many more of you to help us because we think this really will help us understand what causes memory problems. And one hypothesis we have, or guess that we have, is how this works, is that somehow amyloid fans the flames of these tangles that start in the brain, and unfortunately that's really the beginning of memory trouble, and again a place that we want to be able to stop that from happening. So Brad showed you one picture. This is a little bit more of that tau or tangle imaging, and again what we can see is that the good news is a lot of older normal people have neither amyloid nor tau, or just a little bit of tau beginning that builds up as they age. But some of these individuals with a lot of amyloid are also having spread of tau, similar to what we see in patients who already have memory problems and dementia due to Alzheimer's disease. And we have some studies already that suggest, again, it's the combination of amyloid and tau that really predicts who's going to have memory trouble. So we have some people who've already been in the Harvard Asian Brain Study for 4 years, because this September was our 4th year, and many of you have been so kind to come back and do more testing for us. The good news is that most people are doing pretty well. But those who are having a little bit more trouble over time, we can see that we can actually predict that by how much amyloid they had 4 years ago and how much tau they have on these scans now. And again, I know this sounds scary because I'm sure my brain is already putting in lots of amyloid and tau. But the good news is that I think there are things we can start to do about that. And that if we start early enough, we can prevent this kind of decline. So that's the last part of my talk, which is whenever I give a talk like this and I say, well, we can see evidence of Alzheimer's disease beginning 10 or 15 years before people get to the stage of dementia, someone always appropriately asks me, well, why would you possibly want to tell someone or know that you're going to develop Alzheimer's disease dementia if there's nothing you can do about it? I don't know how many of you were sitting there thinking about that when I said that. But I want to argue that that's exactly the way we're going to do something about it. So think about the other fields of medicine where we really have made progress. In cancer, in heart disease, diabetes, HIV/AIDS, osteoporosis, anything where we really actually have drugs that work. It's by detecting the evidence of the disease before there are symptoms and trying to prevent it. I can't think of a single drug that really works better after symptoms than before, except maybe Viagra. That one seems to So I think this is how we're going to get to really bending that curve of Alzheimer's disease. So it's been many times said that Alzheimer's disease is like a tsunami because it's really overtaking. It's a huge wave that is coming. But you know, I don't think this is actually that great an analogy because a tsunami is a once-in-a-lifetime event. And unfortunately, the tsunami of Alzheimer's disease is coming day after day after day. So we must do something to help these little people here in the lifeboats. And I'm very excited to tell you that actually I think one study that has a shot at that has already started. So this is the A4 study that you guys already heard about. And I especially want to say a thank you to the participants in the Harvard Asian Brain Study and the Alzheimer's Disease Research Center, because it was directly the work that we did and are continuing to do in the Harvard Asian Brain Study that made this study possible. So I want you to all feel very excited about this because it's your hard work that really enabled this to happen. So the A4 study is finding individuals who have evidence of amyloid plaque buildup on PET scans, but who don't yet have any symptoms, and they're coming into a 3-year trial with what we call an antibody that's trying to help the brain and body clear out the amyloid. And it's a big trial, over 1,000 people in 60 centers in the US, Canada, and Australia, and we have 3 centers in Florida, you'll be happy to know. And our job in this study is really to evaluate whether if we start early enough with an anti-amyloid therapy, can we really bend the curve and prevent these people from developing memory symptoms. Now those of you who are already in the Harvard Asian Brain Study, we'll hope you will stay in the Harvard Asian Brain Study because that's an important control group in comparison to the A4 study. But if you've got friends and neighbors and lots of people who really want to come and help us, we are actively recruiting for the A4 study right now. And the question about diversity and gender and ethnicity was particularly important. In the A4 study, we are requiring that 1 out of every 5 individuals who get screened for that study come from a diverse group ethnically. And this is because we know that African Americans and Latinos are at higher risk for developing memory problems, but we don't know why. We need to understand, is it this amyloid plaque? Is it something else? And so critically in this study, we want diversity in gender, age, education, ethnicity, religion, any possible thing that can affect one's individual risk of Alzheimer's disease. So we hope you'll help us get the word out there, because this is a challenge. But if we're not going to do it right, who is? So this is the A4 study back on my curve, again, of trying to show you that we're trying to catch people before they move down this curve. The A4 study really is people who have evidence of amyloid plaques, maybe have a little bit of worry about their memory, but aren't yet at the stage of MCI or dementia where it might be too late to fully burn this curve, although we're also running lots of trials at these later stages, also trying to help at that point as well. So my last slide is a better Mother Nature analogy, which is, this is up in Canada, where I go every summer to try to recharge my own neurons for resilience. And although most of my talk today has really been about the negative side, or what we're trying to prevent Alzheimer's disease progressing, but part of the Harvard Aging Brain Study has been trying to understand what keeps so many of you resilient and having good, successful brains and aging. So we're still working on this, and this may take us a little longer to study people over the next 5 years to understand what really protects people. But I'll tell you my top 3 tips. So first is choose your parents wisely, because we do know that there are genetic influences that probably are huge no matter what we do. But we do already have evidence from our study and other studies that staying physically active, in particular with exercise, is protective, staying mentally active, and socially active. So people ask me all the time about crossword puzzles and mental bowling and luminosity, and I think those things are fine. But the most protective thing is coming out and meeting new people, learning new things, being involved with other people. So the best thing you've done is coming here today and being involved again in our studies. And finally, I will say participate in clinical research, and this is not just a joke. What we know is that people who come into studies actually decline at about half the rates of people who don't participate in studies. Now, we know that that's probably a bias because many of you are very intellectually curious, and that's why you come, and you have good family supports. That's why they come and be your study partner. And because just coming and being involved in a study gives hope, gives something that you can be proactive and do about Alzheimer's disease, both for your own risk and especially for your kids and your grandkids, so that they see Alzheimer's disease as a preventable illness like polio and wonder why we were so worried about it 10 or 15 years ago. So I'm going to end here by just acknowledging the incredible group of people I get to work with at the Harvard Aging Brain Study. You've met many of them, and some of them will be here later today as well. And then, of course, give you information, because even though you've been incredible in participating in all these studies, 290, we have another 200 studies over the next 5 years. And without you, we are not going to get these answers. So thank you so much for your participation. I'm so grateful every single day for all the hard work you guys do. Thank you, thank you, thank you.
Teresa, for a fabulous talk. We're going to have questions, but I do want you to know that all of this information is also on the tables out in the foyer, so make sure that you pick up brochures related to this. But now we'll have some questions.
Are you also looking at vascular dementia, and is there any connection?
So that's an excellent question about vascular dementia, or where there are either mini strokes in the brain that can contribute. So we know that it's kind of a two-hit issue that happens with vascular dementia, where both nerve cells that don't get a lot of good blood flow, in the setting of having Alzheimer's pathology, unfortunately, that may triple the risk of developing memory problems. So one of the things we do is try very much to prevent vascular problems, lowering cholesterol, lowering blood pressure. We don't yet fully know whether there's a biological mechanism that links them. That's actually one of the new things that the NIH is pushing to study, because many older people have both, and there are some genetic risk factors that are shared. But I would say at the moment it looks like that it's two separate hits, and we need to be especially good about preventing vascular disease because it makes Alzheimer's disease look worse faster. Yes.
Dr. Hyman mentioned the word gliosis, or at least there was some screening. My question is, are amyloid plaques and tangles aspects of gliosis? Are they types of gliosis?
So that's an excellent question, and of course, Brad may have to rescue me if I say the wrong thing about gliosis. But there are many types of brain cells in the brain, and one of them are nerve cells, and that's where the tangles form. There are also things we call glial cells, and there are astrocytes and all kinds of different forms. Maybe Teresa will show you some of this as well, I'm not sure. And we know that as Alzheimer's disease progresses, that not just the neurons themselves and the plaques that form out of neurons, but these surrounding supporting cells, the glia, also have changes. And I think of gliosis in a simplistic way of being like scarring in the brain, that you start to see these changes again, both in the neurons and the surrounding cells as well. Some of Dr. Hyman's work exactly actually has been looking at what do amyloid plaques do to the surrounding cells, and what do these other forms of amyloid, these little clumps we call, you might have heard oligomers, and how do they contribute? And that's work that's ongoing right now with in the laboratory. Yes.
I noticed
question.
I noticed that you didn't have diet. Is there any relationship of diet to amyloids and tau?
Right, so that's actually an excellent question. I didn't put it up there because I would say the jury is out. So lots of work saying the Mediterranean diet might be protective. Blueberries, spinach, dark leafy vegetables and fruits, phenols they're called, might be helpful, as well as red wine. I personally recommend that one. But very interestingly, it's not as clear when those diet changes have to be, and often they are related to other factors as well, socioeconomic status with diet. So I'm not certain that we know that a diet really is protective. And we have a really interesting finding I was going to put up there, because what we've seen, so all your life, your doctor's probably told you to lose weight. Certainly my doctor has. But one of the things we've seen is later in life, losing weight is not a good thing. And in fact, lower body mass index, we call it, is actually associated with more amyloid. So that's only late in life. So I want to say to you that diet, forget it today, you need to be out there eating lots of chocolate and good things. I'm biased in that way.
Yeah, I have a question. With migraine patients, it dates way back oftentimes to their childhood, and there's reference to white lesions.
Mm-hmm.
And I'm wondering if you see any combined studies with Alzheimer's and migraine on the horizon or forecast.
So the question's about migraine headaches, and we do know that migraine headaches have some relationship to some of what we call these microvascular, very small vessel changes in white matter. You know, it's interesting because migraines are one of the few things that get better as you get older. So most people suffer mostly from migraines early in life and midlife, and later in life, if someone develops a migraine, then we really worry about stroke. So far, we haven't seen a lot of evidence that they are predictive of one of the other. But I'm not sure there's been enough work, because for one thing, migraine wasn't fully recognized until 30 or 40 years ago as a specific kind of headache as well. And so it may be that we need more work, but at the moment, it's not a risk factor.
Have you considered pulling patients in whom you discover tau and plaques into your A4 study?
I knew someone was gonna ask that, and I have to say a double-edged sword for me. If somebody really wants to be in the A4 study, we of course will embrace having them come and screen. But one of the things that is critical for us is to keep the Harvard Aging Brain Study going, so we really understand in the absence of this type of treatment what's happening. So we do, if somebody really develops memory problems in the Harvard Aging Brain Study, we do, and some of you will know, we call you and we would tell you that yes, you really need to go see a doctor. You really need to do something, because our first priority is making sure that you are healthy. In the A4 study itself, I think that our hope is that we will also get additional people who aren't already in our studies to come into the A4 study. It's quite intensive. It has an infusion every month, so it makes the Harvard Aging Brain Study look easy, believe it or not. But we are, if you're interested in it, please talk to us, because there will be people for whom this might be appropriate. The vast majority of people in the Harvard Aging Brain Study probably won't qualify for the A4 study, because you're all doing very well.
I'm just wondering, when do you decide to use an MRI or PET scan? What's the difference? MRI, you can't take that if you're
That's an excellent question about what's the difference. I should have said that between a PET and an MRI scan and how to decide. So a PET scan allows us to look at what we call the molecular pathology. We can see amyloid and we can see tau, and we can't really see that with an MRI. What we see with an MRI is the structure of the brain and sometimes the function of the brain. Those of you who watch face name pictures in that magnet, or while we try to see how does the brain function. And for us, it's critical to have both, so we can try to match up what it is that the amyloid and the tau might be doing to the structure and the function of the brain. So at the moment, I see them as very complementary. I know you guys are like, why do we have to have all these scans? But actually putting those together is really where we've gotten this information. And I think for the next few years, that will be the case. One other thing I didn't mention, but because so many of you have been so generous to help us, is also cerebral spinal fluid, or lumbar puncture. And I know this one is the scariest one to many people. I personally have had 2 lumbar punctures, so I can speak to this directly. But these are also critical studies for us, because those little proteins that we can measure in the spinal fluid, this is what we're looking for on these scans. And critically important for us to know at what point, when we can see it in the spinal fluid, what do we see on the imaging, with the hope that someday we'll completely have non-invasive ways of looking at these proteins. But those of you who've been brave enough to volunteer or are considering it, this is one of the most important things over the next couple of years, so we can really understand what these proteins are, how they build up, and most importantly, how do we get rid of them so that everybody stays as resilient as that lake.
In the progress of the disease, I understand that there is a certain loss of faculties along the progression of the disease. Is there any order in which you lose those faculties, such as executive ability, such as inhibitions, et cetera, et cetera?
That's a really good question. I'll give you a short answer, but I think Dr. Rentz is going to give a whole talk on cognition. But so far, it looks to us that the really earliest change is very challenging memory. So memory for faces and names, memory for lots and lots of words or stories, where we're really taxing the memory system. Again and again, that looks like the very first change. But very soon after, and probably especially in people who have little bits of stroke or changes in white matter, this thing you talked about, executive function changes. And that's being able to multitask, being able to try to do 4 things at once, which I can't do, and also make sure you can plan, think ahead, and do things. That executive function changes. Language and behavioral changes, such as loss of inhibition, are later, but we do also know that there are subtle personality and motivational changes early, such as the word that was used before, apathy, where people get a little less interested in hobbies. Sometimes they seem a little depressed. And so we know these behavioral changes can also happen early as well, and that's one of the things we're especially gonna be looking at over the next few years. I can see that the hook is coming over here on my left. Thanks so